Today, most of the drugs we are using in children suffering from cancer are basically not properly authorized for the use in pediatric setting, mainly because there was, due to the limitation of the number in pediatric community, of course, suffering of cancer, there was no, in the past, a major interest by the company to make the proper study for licensing and giving proper authorization for the use of such a type of drug as a cytotoxic drug in pediatric setting. I have to say that most recently, last year, thanks to the new bylaws which has been approved by the European Community, we can look forward for the future in a better scenario for several reasons, because the company that will ask to license a new drug for cancer, for example, in adult, they will be forced to do studies in the pediatric setting as well. And of course, by offering this interest to the pediatric community, they will have a sort of benefit by having an extension of their patent, which of course is a sort of positive attitude which has been already experimented in US several years ago. I think at this time the European Authority for Drug, which is the EMEA, is taking a very, I would say, wise process. In other words, they basically, together with the scientific society and the scientific community, has made a sort of priority of list of needs for what are the studies needed for all drugs, which are currently used for, let's say, more than 20 years for some drugs. And on these drugs, we have accumulated a lot of experience. So the question is, do we still need to make such a study? But within every type of class of drugs, EMEA has identified specific needs. For example, pharmacokinetic study in children with a very low age, such as below the 12 months of age. After having made this priority list of needs, the next step is to support through the common process of research grant application, even in the most recent framework 7, the possibility to research and to the clinical community, pediatric clinical community, to try to feed this gap only on specific and limited issue. And I would expect that for all other drugs which has been in use for the last 20 and more years in our field, based on the data which has been already published, we will reach soon the step, and definitely this gap will be filled in. There is even the definition of interventional clinical studies, which is an important issue, because if you consider that by giving to a child a very old drug, which is commonly used, let's say in leukemia, is still a research clinical trial in terms of status and definition, that will have a lot of implication in terms of, and there will be a conflict between giving the standard of care, which of course will include such a type of drug, and a clinical study, which is a completely different setting in terms of managing and running this problem, solving this problem. We have been using a large number of cytotoxic drugs in the last 20 or 25 years, and of course, but we are still lacking some data, let's say, as you mentioned, on the pharmacokinetics on specific age group. This is the scenario. The solution would be probably, instead of using the framework of research, which is a competitive-based research frame, you would have probably even consider a different solution. For example, just asking as EMEA, as an agency, a European agency, to specific pharmacokinetics or pharmacology lab in Europe to try to achieve this data, a sort of by using just a formal request instead of making a competitive basic research, which is, as you can imagine, not very appealing, because you are dealing with something which has been already in news for a long time, and you are asking research people to do a research work on something that is needed only to fill in this gap. We have been using cytotoxic drug for a long time, but we are still lacking data which are essential to remove the off-label status from certain drugs. Okay. So what EMEA decided to do together with the EU Commission and the Research DG is to use the Framework 7 to post application for pharmacokinetic study in order to reply to the specific needs with respect to the specific drug and specific needs to fill in. EMEA want to fill in and remove the off-label status for pediatric use of some cytotoxic or most of cytotoxic drug that we are currently using in the off-label status, which is a very strange situation, but we have been using that for the last 30 years by achieving the outstanding results in cancer patients, in children, and that was probably the only way to try to fill in the gap and as soon as possible try to achieve the data necessary for the full license and authorization for pediatric use.